Okay, we're going to talk a little bit about diluting Botox. We get a lot of questions about people asking about the efficacy of Botox, and really most places will dilute Botox in a very standard manner. When Botox first came out, we used to take 100 units of Botox and dilute it in 4 cc's of saline. And then we found that actually if we diluted it in 2.5 cc's, there was less chance of it spreading to areas that we didn't want to. And I'd say that's probably used by about 90% of practices. And really it's pretty simple. This is bacteriostatic sodium chloride. This actually has a little bit of a material in it that helps take out some of the sting of Botox. So if you go and have Botox done and it stings more than usual, they may be using a different saline product. And this is simply drawn out in a 3 cc syringe. We've gone to drawing out the saline and injecting it with a 20 gauge needle instead of an 18 gauge needle. And that's because sometimes when you inject through this bottle, after you've done it a few times, it could drip out of the bottle. But otherwise it's fairly simple. You just open up the Botox and mix 2.5 cc's in. I'm going to talk a little bit about mixing the Botox. Botox is a very fragile compound, and what we do when we mix the Botox is that we inject it, and when I open this, you'll be able to see, of course getting it open is always the hardest part. Let's see. So once we take our Botox out, and I don't know if you'll be able to see this in the video or not, but it's very, very subtle. The Botox is actually that small little tight tiny white powder there. That's the Botox, and the rest is actually just air. And so we'll pop the cap off. This is a special tool. It's from Germany. I'll let you zoom in here and you can see the company is kapoff.com. A lot of people ask us where we got this opener, kapoff.com. And that allows us to pry the top of the Botox off. We would inject 2.5 cc's and then just gently roll or swirl the Botox. And that's it. Your Botox is ready to go.